Hi everybody. We're going to talk about how periodontal disease occurs and how it progresses directly from gum disease. As we remember from our first video, what we discussed in the first video was the development of how plaque occurs from food that has stayed in the tooth for too long, and that created a situation where the body develops an inflammatory process where bleeding occurs. So this can even occur when we brush our teeth. So we can get bleeding in the gums when we brush. And so now at this point, if the plaque stays around the tooth for too long, a new process occurs. So plaque is soft and easily removable with the bristles of a toothbrush as long as the bristles are hitting the tooth structure at the right spot. But if it's not removed effectively, then the process continues, and let's go through that right now. So here we have our plaque getting stuck, releasing toxins. The body's gotten irritated and sent extra blood to kill the toxins and kill the bacteria. But now at this point, the plaque has stayed in the tooth structure, and it hardens up. And now it becomes something called tartar. Tartar is just plaque that has stayed for too long and has hardened up. Tartar will act in two ways. At this point now, it's a rough spot on the tooth, and it begins catching more food, and it protects that food from being cleaned. If a bristle of a toothbrush hits that spot, it will deflect and get knocked off from the tartar. So the tartar will stay on the tooth. And so it protects that food, and bacteria that live in our mouth begin eating the food. They release toxins, and since it can't be cleaned, that hardens up and turns into tartar. And that does two things. It catches more food, and you can see how the process continues. And that can't be cleaned, so it releases toxins. It collects bacteria and releases toxins, and you can see how the process occurs. At this point, the body has some decisions to make. At this point now, the body has already been trying to kill all these toxins by sending extra blood to the area. However, at this point now, if the body continues doing this, the toxins from the bacteria are going to pour into the bone, and the body can't have that. So the body actually changes its cells and sends different kind of blood cells to the area, and this time it tries to just destroy the top of the bone so that it makes more space for the tartar and the bacteria to continue growing. And if it doesn't stop, the body will remove more bone until the process stops. And so here we keep having tartar that gets developed in this area. And now the bone looks, we'll go to the other side of the tooth to show how the bone looks. The bone looks entirely different. The bone begins breaking down and looking very, very choppy and not so sharp anymore. And the gum tissue starts to proliferate, starts to grow down the tooth. And as you can see, the spaces between the gums and the tooth are beginning to get deeper and deeper. And this would be something called periodontal pocketing. And this will occur either until all the tartar along this space is removed and the irritants are removed, or until, unfortunately, the bone loss becomes so great that the tooth becomes lost. Because once the bone gets to a certain spot and the tooth becomes wiggly, then the tooth becomes untreatable, and we would need to remove it in order to make the gums and the bone healthy again. And once again, we'll go back to our levels down here. This last level, we would have bleeding. And sometimes we even have pus. And this would be called periodontal disease. Or periodontitis. It's very important to remember that all of this began with food that got stuck on the tooth that stayed for too long, the bacteria began collecting around the food and began multiplying and dividing. They released their toxins, irritating the body, and that stayed for too long, and that became tartar, which caught more food, turned into plaque, became more tartar, and the whole process continued. We have the opportunity through our training program and through all the products that we're able to offer to you, and through the knowledge that we can give to you, we have the opportunity to be able to stop the process at this level here and keep things healthy on a daily basis. We look forward to working with you. Thanks for joining us.